Hello students, welcome to the new session of Cardiovascular Physiology. In this lecture we will see about the blood pressure and the short-term regulation of the blood pressure. So, what is the definition of the blood pressure? It is the lateral pressure exerted on the walls of the vessels by the column of the blood when flowing through the vessels. That means whenever a column of the blood is flowing through a vessel and number of molecules of the blood, they are bombarded over the lateral wall. So this molecules bombarding over the lateral wall on a unit area in a unit time, that is nothing but the blood pressure. What is systolic blood pressure? It is the highest blood pressure during the systole. That is called as the systolic blood pressure. The normal value for the systolic blood pressure is 100 to 140 mm of Hg. What do you mean by diastolic blood pressure? It is the lowest pressure during the diastole. The normal value of the diastolic blood pressure is 60 to 90 mm of Hg. So, how much is the normal blood pressure? Generally, the standard value we take it as 120 is the systolic blood pressure, 80 is the diastolic blood pressure. So, it is called as 120 by 80 mm of Hg. What do you mean by pulse pressure? Pulse pressure is the difference between the systolic and the diastolic blood pressure. So, if the blood pressure is 120 by 80, what will be the pulse pressure? Pulse pressure will be 120 minus 80, that means it is equal to 40 mm of Hg. Then, what do you mean by mean blood pressure? Because whenever the pulsatile blood flow is turned into a continuous blood flow, ultimately the blood will have the mean blood pressure. So the body is more interested in maintaining the mean blood pressure than the systolic or the diastolic blood pressure. So what is this mean blood pressure? Mean blood pressure is the diastolic blood pressure plus 1/3 of the pulse pressure. That means what will be the calculation? As you can see in this, diastolic blood pressure is 80 mm of Hg and 1/3 of the pulse pressure, that means 40. So it will be equal to 93.33, that means mm of Hg. As you can see here, the mean blood pressure, it is more towards the diastole. Logically, according to mathematics, what should be the mean blood pressure? It should be a mean of 120 plus 80, that means it should be 100. But it is not 100, it is more towards the diastolic blood pressure. Why this is so? It is because the duration of the diastole is more than that of the systole. If you recall, what is the duration of the diastole? 0.5 second. How much is the duration of the systole? 0.3 second. So therefore the contribution from the diastole will be more. So that's why the mean blood pressure will be more towards the diastolic blood pressure, and it is equal to 93.33 mm Hg. Now, what determines the blood pressure? So systolic blood pressure is mainly determined by the cardiac output. That means any factor which is going to affect the stroke volume, which is going to affect the heart rate, that is going to change the blood pressure. If there is an increase in heart rate, increase in systolic blood pressure, as well as there is increase in the diastolic blood pressure. But the proportionate increase in the systolic blood pressure is more compared to that of the diastolic blood pressure. In turn, diastolic blood pressure is mainly determined by the peripheral resistance. And the peripheral resistance is mainly determined by the muscular arteries and the arterioles. Okay, so and again the peripheral resistance is also determined by the viscosity of the blood, velocity of the blood flow. If the velocity of the blood flow decreases, the peripheral resistance will increase. There are some changes which are taking place in the blood pressure with the age. At birth, the blood pressure is 40 mm of Hg. Then it increases rapidly to 80 mm of Hg within a month. And at about 17 years, it reaches to the adult range, that is 120 by 80 mm of Hg. But with the old age, after 40 years, there is slight increase in mainly the systolic blood pressure, and the blood pressure at the age of 70 years can be 160 by 90 mm of Hg. Blood pressure, when it is measured, normally the blood pressure should be measured at the level of the cuff, should be there at the level of the heart. But in a standing position, if I take the blood pressure in the femoral artery, now the pressure in the femoral artery will be more. It is because of the gravity. So what is the effect of the gravity on the blood pressure? With 1 centimeter height, that means there is a change of 0.7 mm of Hg of the blood pressure. That means if I go down by 10 centimeters, then from the heart level the blood pressure will increase by 7.7 mm of Hg. So this is the effect of the gravity. Now, regulation of blood pressure. There are various mechanisms which can regulate blood pressure, but according to the duration in which they can regulate it, we will call it as the short-term regulation of blood pressure, mechanisms which regulate the blood pressure for the intermediate time, and the long-term regulation of the blood pressure. Short-term regulation of the blood pressure, they will act quickly and they will regulate the blood pressure within very short time, but they are ineffective in long term. Whereas the long-term regulation of the blood pressure are the mechanisms which will be very effective in long term, but they will not be able to manage, or they will not be able to adjust the blood pressure, regulate the blood pressure in very short time. What are the examples of the short-term, intermediate term and the long-term regulation of the blood pressure? As you can see in this slide, short-term regulations, what are the examples? Is mainly the nervous mechanisms. Is mainly regulated by the nervous mechanisms. And which are the example? Baroreceptor reflex, we will see in detail about it. CNS ischemic response and the chemoreceptor reflex. So these are the one which are the examples of the short-term regulation of the blood pressure. Intermediate term regulation of the blood pressure is by renin-angiotensin vasoconstrictor mechanism. Then stress relaxation and the reverse stress relaxation. If there is an increase in the blood pressure, initially the vessels will remain same. The diameter of the vessels will remain same. But if there is a sustained increase in the pressure, then the vessels will just dilate. So because of that, what will happen to the pressure? The pressure will come down. Reverse will happen if there is a hypotension. Got it? So this is called as stress relaxation and the reverse stress relaxation. Capillary fluid shift mechanism. What will happen in capillary fluid shift mechanism? If the blood pressure has increased, the perfusion pressure will increase. So the more fluid will go into the interstitium. So the amount of the fluid in the vessels will decrease and the blood pressure will decrease. This is called as capillary fluid shift mechanism. Long-term control of blood pressure is mainly caused by kidneys. And they cause slight change in the blood volume. Ultimately, which is going to affect the blood pressure for a very long time. We can keep the blood pressure normal for a very long time, such as renin-angiotensin system. So, as you know that renin will convert angiotensinogen into angiotensin 1 and ultimately angiotensin 2 will be formed, and this angiotensin 2 can have the salt and water which can be retention, it can cause vasoconstriction, it can cause ADH release. So with all this mechanism, it will stimulate thirst. So with all this mechanism, it can increase the blood volume. And if the person in the hypotension, this will be helpful to increase the blood pressure. Aldosterone again, which is an hormone which will cause retention of the salt and water. And because of that, the more amount of the blood volume can be increased and the blood pressure can be regulated. Now in detail, we will see about the short-term regulation of the blood pressure, and is mainly related to the baroreceptor system, how it is going to affect the cardiovascular regulatory center which is present in the medulla, and ultimately how it is going to cause the sympathetic and the parasympathetic response to change the blood pressure. The short-term regulation is very important in a sense that it will regulate the blood pressure in day-to-day life. As we have seen that if the person is lying down, and if the person stands suddenly, because of the gravity, the blood will be pulled towards the dependent veins. And because of that, the venous return will decrease, the cardiac output will decrease. This will decrease the blood pressure. If the blood supply to the brain is not maintained constant, ultimately there will be decrease in the blood supply to the brain. So immediately this decrease in the blood pressure is detected by the baroreceptors, and they can cause the baroreceptor reflex, can cause the change in the blood pressure immediately, so that the blood pressure is brought back to the normal and the blood supply to the brain can be maintained. So what are these baroreceptors? Where they are situated? They are situated mainly in the carotid sinus. Now after the division of external and internal carotid artery, there is a swelling or there is enlargement which is called as the carotid sinus. So this carotid sinus has got the stretch receptors. They will be more when they will respond, or they will fire more if they are stretched. So they are called as baroreceptors. Whenever the pressure inside the carotid arteries increase, there will be stretching of these receptors, and because of that the number of action potentials in them that will increase. So these are carotid sinus. These baroreceptors are also present in the arch of aorta. The baroreceptors are also present in the atria of they are also present in the superior vena cava, inferior vena cava. Now, this baroreceptors we are mainly concerned here is the present in the arch of aorta and in the carotid sinus. What is the important function of them? They will generate the impulses whenever it is being stretched, and these impulses are carried by the nerve. Which are the nerves which carry them? From the arch of aorta, vagus nerve will carry the impulses, whereas from the carotid sinus, hearing nerve, which is again a branch of glossopharyngeal nerve, that will carry the impulses in the brain, that is towards the cardiovascular regulatory center. What you have to remember is that always the vessels are partially stretched. So some number of the action potentials are constantly being passed towards the cardiovascular regulatory center. What will happen if there is a hypertension? If there is a hypertension, now more stretch will be there, and the number of action potentials through these two nerves will increase, and more action potential will go to the cardiovascular regulatory center. If there is hypotension, what will happen? Collapse of baroreceptors, and the number of action potentials that will decrease, right? So this is this. Now next, coming to the cardiovascular regulatory center. Cardiovascular regulatory center is situated in the medulla. It is situated at the floor of the fourth ventricle. And what are the parts of this cardiovascular regulatory center? It has got this as the relay center. That means it will act as a sensory area. The action potentials from the glossopharyngeal and the vagus nerve, they will go to the nucleus of tractus solitarius, which is a sensory area or the relay area. Then this nucleus of tractus solitarius will send impulses to the sympathetic area as well as the parasympathetic area. Now these areas are present on both the sides, but I have just drawn it for simplification. I have just drawn the sympathetic area this side and the parasympathetic area on this side. So, which is the parasympathetic area? Parasympathetic area is the nucleus ambiguous. Because what arises from the nucleus ambiguous? The vagus nerve. And the vagus nerve will give the parasympathetic supply to the heart. So, this we can call it as the parasympathetic area. Sympathetic area is again divided into depressor area and the pressor area. This is the sympathetic area, which is again divided into depressor area and the pressor area. And ultimately the fibers will arise from the pressor area. They will go to the spinal cord, and the sympathetic fibers will arise from the spinal cord. So this is the sympathetic output, which is again supplying the blood vessels and the heart. And the parasympathetic output is through the vagus nerve, and which arises from the nucleus ambiguous. Now, if you look at the structure or the connection here of this reflex, what you see is that glossopharyngeal nerve and the vagus nerve, they will carry the impulses from the baroreceptors. They will stimulate the nucleus of tractus solitarius. So they will release the glutamate, which is a stimulatory or facilitatory neurotransmitter, excitatory neurotransmitter. Glutamate is released here. So nucleus of tractus solitarius is stimulated. Now the second order neurons will start from here, nucleus of tractus solitarius, and the impulses will be sent to the nucleus ambiguous, again which is stimulated. Impulses will also be sent to the depressor area. So the impulses from the nucleus of tractus solitarius will go to the depressor area, which are again stimulatory. Then once this nucleus ambiguous is stimulated, what will happen? The parasympathetic system fibers, so vagus nerve, through the vagus nerve, they will be again stimulated. And if the parasympathetic fibers they are stimulated, what will happen? They will decrease the heart rate, they will decrease the force of contraction. What will happen if the nucleus of tractus solitarius is stimulated? Then they will send the impulses, excitatory impulses towards the depressor area, and depressor area will get more activated. Because of that, it will send impulses to the pressor area. But now here you have to remember one most important thing. The impulses from the depressor area to the pressor area, when they increase, the neurotransmitter release is the inhibitory neurotransmitter. That means if the depressor area is more excited, it is actually going to cause inhibition of the pressure area. So what? It is because of a inhibitory neurotransmitter GABA. So which is the neurotransmitter release here? Is the GABA. So GABA will cause inhibition of the pressure area. So if there is an inhibition of the pressure area, what will happen? Inhibition of this descending fibers and ultimately inhibition of the sympathetic fibers. So if there is inhibition of the sympathetic fibers, what will happen? There is a decrease in the heart rate. There is a decrease in the force of contraction. And again there is a vasodilation. Now I will try to explain you this with all the cyanoaortic or the baroreceptor reflex with the example. Let's say that if the person is having hypertension. So what will happen? Now just remember, in the resting stage, some amount of the impulses is already passing through the glossopharyngeal and vagus nerve. Because of that, some amount of the impulses are also going to the depressor area, some impulses are going to the pressor area, and if you recall now, even the heart is having the vagal tone and the vessels are having the sympathetic tone. So some amount of the sympathetic supply is always there and some amount of the parasympathetic supply is always there. What the baroreceptor reflex or cyanoaortic reflex will do, it will just increase this tone or decrease this tone. Either it is going to increase the sympathetic supply or decrease the sympathetic supply. Now if the person is having hypertension, what will happen? The more stretching of the baroreceptors. Now because of that, what will happen? The number of action potentials will increase. Once the action potential will increase, more glutamate is released there. More stimulation of nucleus of tractus solitarius. If there is a more stimulation of nucleus tractus solitarius, it is again going to stimulate nucleus ambiguous, because again excitatory neurotransmitter is released here. If the nucleus ambiguous is more stimulated, what will happen? Again it will stimulate the vagus nerve, and because of that, more parasympathetic supply, decrease in the heart rate, decrease in the force of contraction, which is useful to decrease the blood pressure. When you look at the sympathetic system here, what you see, if nucleus of tractus solitarius is more stimulated in hypertension, what will happen? More stimulation of the depressor area. More stimulation of the depressor area means what? More amount of GABA is released here. More amount of GABA is released, that means there is more inhibition of the pressure area. And now the number of action potentials to these fibers will decrease. If this decreases, it will also cause decrease in the action potentials from the sympathetic system. So there is a depletion of the sympathetic supply. So because of that, what will happen? The vessels will dilate. The force of contraction, the heart rate will decrease, and because of that, the blood pressure can be brought back to the normal. Just opposite will happen if the person is having hypotension. So this reflex is called as the cyanoaortic or baroreceptor reflex. This is very important reflex to maintain the blood pressure in a short time, and this reflex can bring back the blood pressure within seconds. Within seconds it can bring back the blood pressure to the normal. Now this cardiovascular regulatory center is modulated or it is affected by many of the other centers. Which are those other centers? Cerebral cortex. You might be knowing that. If you are going for the exam, suppose you are going for now your PG entrance exam. So what will happen? Just the thought of the exam has increased your heart rate. Why this has happened? It's because from the cerebral cortex, it is going to affect the cardiovascular regulatory center. Not only that, in anger, sexual excitement, in emotional shock or flight or fight kicks, that means whenever you are afraid or when you are angry, in all these cases, there is increase in the heart rate is because of the effect over the cerebral cortex over the cardiovascular regulatory center. Emotions, pain, they can cause change in the heart rate and the blood pressure. It is because of the effect of the hypothalamus over the cardiovascular regulatory center. As well as pain can stimulate the reticular activating system, and because of that again the heart rate and the blood pressure can change. Sinus arrhythmia, That means there is the increase in the heart rate during inspiration. Why this happens? Whenever the person is inspiring, the respiratory centers will send signal and they will cause inhibition of the nucleus ambiguous. If there is an inhibition of the nucleus ambiguous, what will happen? The vagal tone is decreased and the heart rate will increase. So this is the basic cause of the sinus arrhythmias. Even the chemoreceptors, which can sense the oxygen concentration or the carbon dioxide or H plus ion concentration, ultimately they are also going to affect the blood pressure and the heart rate. They send impulses to the cardiovascular. This is called as chemoreceptor reflex, which is also an important short-term regulation mechanism of the blood pressure which can be maintained. These bioreceptors, as I have told you, they are also present at other places such as atria. What is the function of these bioreceptors present at the other places? These bioreceptors they will be calling as a low pressure receptors. And as you can see here, they can stimulate number of reflexes. If there is a decrease in the blood volume, there will be decrease in the venous return. Now what will happen because of that? Decreased stretch of the atrial bioreceptors, right? And if there is a decreased stretch of the bioreceptors, even it can decrease the heart rate. Or if there is an increased stretch of the bioreceptors, if there is an excess accumulation, if the venous return has increased, and in that case there is a stretching of the atria, mainly the right atrium, and the SA node is present over the right atrium. So the action of the right atrium, the rate of generation of the action potential from the SA node, that is going to increase. So what will happen to the heart rate? The heart rate will increase and ultimately the cardiac output will increase. So this is called as band bridge reflex. It is called as band bridge reflex. They can induce vasodilation. If they find that if the venous return is much more, if there is a congestion of the blood in the heart, then they can induce vasodilation. Not only that, they can release ANP, atrial natriuretic peptide. So this is the endocrine function of the heart. And what the atrial natriuretic peptide will do? It will cause natriuresis. That means it is going to cause more excretion of the sodium and water from the kidney. And therefore the blood volume can be decreased. It will also decrease the ADH release. So ultimately it is going to increase the GFR and ultimately it is going to cause diuresis. But this bioreceptor, though it is very helpful for short-term regulation of the blood pressure, it becomes ineffective if the blood pressure remains sustained high or low for 4 to 5 days. Why this happens? This happens is because of the phenomena that is called as the adaptation or resetting of the bioreceptors. Now what will happen in this case? If the hypertension is there, the number of action potentials to the glossopharyngeal and vagus nerve should increase. They will increase for 4 to 5 days. But then, in spite of sustained increase in the blood pressure, the number of action potentials through the bioreceptors, they will decrease. This is called as resetting of the bioreceptors. The bioreceptors will set to the increased blood pressure. So therefore, this is called as resetting, and this is the main reason why the bioreceptors are ineffective for the long-term control of the blood pressure. Other reflexes for the short-term regulation of the blood pressure, as you can see here, the most important is the CNS ischemic response or CNS ischemic reflex. What is this reflex? Whenever there is a decrease in the blood pressure, especially below 60 mm of Hg, this will become very active. At the level of 15 to 20 mm of Hg, this is the most active response. What will happen in that case? The blood supply to the brain will decrease. So there is CNS ischemia. Because of that, lactic acid and CO2 will accumulate near and around vasomotor center, and they will cause strong stimulation of the vasomotor center. This even can be called as the last effort by the body to save itself, to increase the blood pressure and so that the blood supply to the brain that can be maintained back. Chemoreceptor reflex we have already seen, which will act as an important. Then we are seeing that most of the time the vessels will have the sympathetic supply, which is going to cause the vasoconstriction. Is there any nervous vasodilators mechanism? Yes. The nervous stimulation can cause vasodilation in few cases. How does the vasodilation can occur? The first, if there is a decrease in sympathetic tone, then the vessels will dilate. Especially the vessels of the muscle, they have got called as the cholinergic sympathetic fibers. That means what? Whenever there is a sympathetic stimulation, instead of releasing adrenaline or noradrenaline, these neurons will release acetylcholine. So these are called as cholinergic nerve fibers, and these are important one to cause vasodilation. So this becomes very important that whenever we do exercise, there is going to be sympathetic stimulation, and sympathetic stimulation generally causes vasoconstriction, but vasoconstriction will decrease the blood flow, but the blood flow to the muscle should increase. So therefore the muscles have the sympathetic cholinergic vasodilators. Sympathetic adrenergic vasodilators, even the release of adrenaline, this can cause the vasodilation if it is acting over the beta receptors. This can be seen in coronary arteries, skeletal muscle, salivary gland and liver. Then there are some places where the parasympathetic supply is there, which is going to cause the vasodilation through acetylcholine and nitric oxide, such as salivary glands and in genitalia, again which is responsible for the erection. So with this we come to the end of this lecture. Thank you.